Hi, I'm Danae. I'm the respiratory therapist with Physician's Choice, and today we're going to go over how to use a CPAP. So once you get diagnosed with sleep apnea, you've had a home study, then the next step is to learn how to use your CPAP and determine which mask is best for you. So we're going to go over that today. This is Brian, and he's my patient today. So when you've never had a CPAP, they're usually set in an auto range. So that means a range of pressure from typically from 5 to 15 or 5 to 20, so that the machine every night will find what pressure you need, and that'll vary. So I'm going to ask you, Brian, a couple questions. Do you have any problems breathing just through your nose and keeping your mouth closed? Okay. So if you have no sinus issues and you can keep your mouth closed at night, then we can go with something like this, which is a nasal pillow mask. It's very simple because your mouth has to stay closed when you're wearing your CPAP. If you don't, pressure's going to go in your nose and right out of your mouth, and it's not going to do you any good. It won't be effective. So we're going to use the P10 nasal pillow mask for Brian today, and then if you do open your mouth, the other option would be a full mask that covers your mouth and your nose, and that would allow you the freedom to breathe through your mouth. Something like that would look like a mask like this, and it covers your mouth and your nose. So it gives you a little more freedom. All right, so we're gonna go over how to use the CPAP. So I have one right here. This is a Philips Dream Station, and it's very simple. It's already set. It's one button to turn it on, and you'll see the number 5 in the screen. That's the minimum pressure. That's the start pressure. And it will only go up as you start to drift off to sleep. So it's a nice gentle rise, and then as you're waking up in the morning, it'll fall down again to lower pressure, so it's really easy to work with. The off button is the same button. On and off is one button. The other thing I'd like to show you is how you can look at your data as well. When you're done with your usage in the morning, you can look at your info. And you just press this button here, and it will show you how many hours you used your machine. So your goal is a 4 hours or more. That's considered therapy. So that's your minimum goal. And then the next screen will tell you if you're still having apneas with your CPAP on. So that's kind of informational for your physicians. And then if your mask is fitting well, 100% is best. So we like to see 90 to 100%. And then if you continue to scroll through, it'll tell you where your pressure's averaging. So this machine can also go to what we call a fixed pressure, which we would gather from this data, if that's what your doctor would like. And there's an app for your phone if you want to see how you're doing, or your computer. And that's a free app. And then back to the main screen. So pretty easy to use. Your filter is on the side here. This just pulls out. You're going to want to wash this once a month with warm soapy water. Slides back in, and it's good for 6 months. On the opposite side is your modem, and this modem is what allows us to pick up data for your physicians and see how your therapy is going. And that doesn't require anything for you to do but leave the machine used and plugged in. So this is your tubing. The tubing is the same on both ends. So we're going to hook up one end to the back of the machine, and then they just kind of wiggles on. It doesn't pull off for safety. You have to wiggle it on off. The other end, of course, is going to go to the mask. And at this point, we're going to let Brian try this out. So before you put this on, I just want to explain one thing since you've never tried this. When you're breathing in, it feels very natural and easy to breathe in. But when you breathe out, you're exhaling against pressure. So there's some resistance there. So that feels a little strange initially, but it will get easier as you start using it. Okay, good. So we have one strap in the back and one strap kind of on top of your head. And here we go. So I'm going to let you turn it on. And then just breathe in. Now it's a super quiet system. And if you hold your hand in front of your face, Brian, you're going to feel a little air coming out of the front. That's where you're exhaling your carbon dioxide, so you're not rebreathing it. It's super quiet. And it is a little difficult to talk because once you open your mouth, you break the pressure seal. So it's very important to be able to have your mouth closed. So this will keep your airway open, because with sleep apnea, your airway is obstructing, it's closing down. So this pressure is going to be going in and keeping your airway propped open, so it prevents the sleep apnea from occurring. Okay, and then you can turn it off. How did that feel?
Weird.
Okay.
Yes. Can you tell me, is that the correct size for me?
Yes.
Would you think a medium?
Yep. This is a medium. They come in small, medium, and large. Every mask comes with all three. So You don't want it to be too big because then it's not going to fit, and if it's too small, it's going to leak. So medium's the best size for you.
Okay.
And it was quiet, so we know that it wasn't too
never heard
small.
a thing.
Okay, great. So that's a simple CPAP setup. And there's always things that we could tweak from there if need be, whether mass changes or pressure changes with a physician order. Thank you.